Previously on Black Box.
The legislature gave us a critical task to determine projects and how the expenditures will be recommended to the legislature.
Going over these applications, there's some really exciting ideas.
It's hard to trust us because we're criminals.
What would be the benefit of tasers?
We're all talking about the symptoms of drug use. We talked about nothing to prevent it.
It's just in the open lobbying for their interests.
People are going to die more.
Every January, Mississippi's 174 state senators and representatives from all corners of the state make their way to Jackson, to the state capitol building. They're lawyers, nurses, accountants, teachers. But for 3 months a year, they hold a second job, running the Mississippi regular legislative session. This is the place where change happens. These Mississippians write and debate bills and make laws. They also pass a state budget, which determines what your public services look like your hospitals and schools. Political priorities color almost every decision. And in 2026, Republicans held majority control in both the House and the Senate.
Let the House please be in order. Please stand this afternoon.
Really, what the legislature is supposed to do is address the state's problems.
Before us, we've got 5 bills. First one I'm going to call up is 2567.
Senate Bill 2242.
Senate Bill 2437, it's artificial intelligence and defining it.
The Mississippi Math Act, I'm going to represent.
Lawmakers would also decide what to do about the state's tens of millions of opioid settlement dollars, the penance paid by companies that contributed to the opioid epidemic. 3 years since they started receiving payments, Mississippi's elected officials used less than 1% of the funds to directly address the crisis. We've heard why throughout this series. In the 2026 legislative session, lawmakers would approach opioid settlement funds differently. They had to. State law said this year, the legislature would approve or reject the advisory council's recommendations. Lawmakers can make up to $105 million worth of state opioid settlement decisions. They could also change the laws that govern the funds, which some already had plans for. But there are 174 decision makers working under the Capitol dome. Any of the thousands of proposals lawmakers considered would need the blessing of both the House and the Senate, and ultimately, the governor's signature. It's always an uphill battle. Over the next 3 months, there were 2 questions. Would Mississippi's legislature address the state's opioid settlement problems? Would money get spent in ways that honor over 10,000 Mississippi lives lost to overdoses? From Mississippi Today, Deep South Today, and Goat Rodeo, this is Black Box. I'm Alan Siegler. In January, when the session was in its first few weeks, lawmakers were busy discussing and voting on bills. Opioid settlements didn't come up much during that time. Those I talked to said they would focus on it later, when it was time to work on budget bills. Toward the end of the session's first month, dozens of Mississippians, many of whom had struggled with addiction personally, traveled to downtown Jackson for Recovery Day.
Thank you, Mr. President. Ladies and gentlemen, in the gallery today, it is Recovery Day here in Mississippi, and we have people who are celebrating their own recovery. I want them to know that we're very proud of them for doing that. We have about 385,000 Mississippians who are currently dealing with their addiction. So today I also ask that we keep them in our thoughts and prayers and their families. But congratulations on your recovery.
On the marble hallways of the Capitol's first floor, Mississippians who work in addiction treatment set up tables and handed out pamphlets. A floor above, Recovery Day attendees poured coffee in styrofoam cups and shook hands with the lawmakers who dropped by.
Part of our program, the way that I lead it, is discovering your voice. And
Emily Schell, Grace House's director, wanted clients to be there that day. Civic engagement had been important to Schell since she graduated Grace House years ago.
advocacy is part of recovery. You learn how to use your own voice and be present for things that matter.
The previous summer, Schell had worked on Grace House's application for opioid settlement funds. the one to expand treatment for residents, the one the advisory council had ranked in the middle.
It was not surprising to see the projects that did rank 1 and 2. And, it was a huge conflict of interest. And I feel like the programs that really deserve and could benefit and that are actually going to put in some real work, some life-changing work that'll actually impact people's lives, I feel like we were definitely overlooked.
I'm really sorry. The public still hadn't heard much about what would happen with the state's opioid settlements. Lawmakers still hadn't shared many specific plans of action. But soon, they would agree, disagree, or abstain from voting on laws that could change the lives of those struggling with addiction, and the lives of Mississippians in general.
This is hard work, and to see a bill come onto the floor and the signs start lighting up, the yeses and the nos going in, it's like, hold on, like the nos, like, did you even hear what this bill was about? Like, it just makes me question.
That process, those dings and the yeses and the nos are going to be how tens of millions of dollars could either go to organizations like yours or to other places. How does that make you feel right now?
A little anxious. A little anxious.
Would you tell me what you ate for breakfast this morning?
I didn't eat anything.
Nothing? Okay.
I got up at 3:30.
Oh, that's not the morning.
I couldn't sleep.
Representative Sam Creekmore seemed tired when the podcast team and I met up with him in mid-February, and understandably so. It was the second month of the legislative session, and he'd been busy. For starters, it'd been a bad winter. His region of North Mississippi was still recovering from a historic ice storm a couple weeks earlier. Creekmore was balancing trying to help keep his city's water running while trying to change Mississippi's state law. He and other lawmakers had been commuting into Jackson weekly, where their days were full. Throughout the last 6 weeks, they'd written and considered hundreds of bills. Over half the session was still left, and addressing how Mississippi would spend opioid lawsuit funds was still on Creekmore's list.
And as you know, I've spent a whole lot of time on the opioid settlement, and so I have not been able to do as much as I wanted to with that, so we've kept it going through the process.
There was one opioid settlement bill he made progress on. It centered on an experimental drug called ibogaine, a psychedelic that may be good for addressing addiction, but is backed by very little reliable research. Creekmore was a strong believer in ibogaine, and his bill would allow opioid settlement money to fund clinical trials for the drug. He proposed using a separate pot of settlement money the state said lawmakers could spend on whatever they want. The rest of his opioid settlement plans, he said, split into two main directions. 1, Creekmore planned to act on the advisory council's recommendations. 2, he wanted to change the laws governing city and county opioid money, or lack thereof, money that, as of last fall, local leaders were much more likely to spend on general expenses rather than addressing addiction. Creekmore had heard what Attorney General Lynn Fitch's office said after Mississippi Today's investigation, that the local funds are supposed to replace money spent on decades of fighting the opioid epidemic. And he understood it. The ambulance calls, the hospital stays, the autopsy reports, they all added up. Still, Creekmore wanted guardrails on that local spending. He thought local money should be spent for abatement, addiction treatment, recovery, and prevention.
I still believe that this money should be spent on the abatement process at all levels. So we're going to proceed, and hopefully we'll gain support with our senators too. And I think they're in principle agreeing to this.
He was still working out the details, specifically how prescriptive the law would be, whether it would offer guidance or impose hard requirements. The difference matters, because without requirements, guidance can mean very little. At what point does guidance and awareness not suffice? At what point does it have to be a requirement that this money is spent on abatement?
Well, if we can get this bill done, then it does what I intend for it to do. It would be July 1. Yeah. So they would need to spend their money on the guns now.
But legislative sessions are unpredictable, even for powerful lawmakers. A bill can die for reasons that have nothing to do with its merits.
I've had so many things that I thought were very important to public health that get caught up in something that's not even relevant, but because of the political points of view and political capital spent, the legislation dies.
But on this issue, he said things had been different so far. The politicking of it all hadn't come up.
I have not experienced any of that with this issue. And it tells me that every community, every representative knows the feeling of loss in their community, and they want to get help to them as quick as possible and spent the right way.
I was curious what Fitch, who had finalized the original arrangements around Mississippi's local opioid settlements, thought about Creekmore's idea for local funds. Her office didn't respond to an email asking for comment about it. As for the second part of Creekmore's plans, his thoughts about what to do with the state funds were less formed. But he was working on it, starting with the Advisory Council's recommendations.
And I was able to look at the council's recommendations in more detail this past weekend.
As a member, Creekmore had watched the Advisory Council form its recommendations. He didn't think all applications were fairly considered. He thought some worthy organizations had been scored in lower tiers than they should have been.
And so I would like to look at those and then see if there is a pathway. I would like to look at how we can take care of some more tier 3s, or not necessarily change the tier system, but how we can award some deserving people.
At face value, this might sound fair. Why shouldn't the legislature fund the projects it thinks are best? But despite its flaws, the Advisory Council was the system lawmakers like Creekmore had built to make these decisions. If lawmakers started making significant alterations to the council's recommendations, even for ideas public health experts might prefer, it would set a precedent for Mississippi's opioid settlements. That lawmakers trusted their own judgment over the process they created and applicants had followed. Had it been the first or second year of Mississippi receiving opioid settlement funds, maybe lawmakers would have paused. But it was year 4. Creekmore said he and other lawmakers would get going on opioid settlement work. Tomorrow.
We'll start ramping up the appropriations.
We'll be back after the break. We're back. In March, lawmakers made some of their opioid settlement plans public. 2 bills, one in the House and one in the Senate, had been amended with major updates. In the Senate, Republican Nicole Boyd amended one of the bills to add 2 new major parts. The first, a proposal to avoid potential conflicts of interest within the Advisory Council. The second, a proposal to extend the legislature's authority beyond simply approving or denying council recommendations. They wanted the ability to change how much money each awardee would receive. In the House, Creekmore proposed a plan as well. His amendment would require the state to contract with an outside group, one that can improve the Advisory Council. Additionally, Creekmore offered his changes to how local governments should spend opioid money. Standing at the podium on the House floor, Creekmore laid out his plan to his 121 colleagues.
It's pretty simple. All opioid settlement funds received by the local government shall be used exclusively for abatement of harms caused by substance use disorder and related public health issues. No opioids.
It was a harder line than he'd drawn before. Over $40 million of local money, still to be distributed, would have to go toward addressing addiction. Cities and counties wouldn't be able to quietly spend settlement money on whatever they'd like. They'd have to spend it on tools directly addressing the opioid epidemic, like naloxone or recovery housing. Each proposal, Boyd's and Creekmore's, passed their respective chambers without a single no vote. But the process wasn't done. The 2 bodies decided to negotiate final language that would go into one bill. To do so, they'd have to have a separate conference. 3 senators and 3 representatives, including Boyd and Creekmore, planned to gather to hash out the details. When these types of negotiations happen, they're required by Mississippi legislative rules to happen in public. That's the theory, at least. But for years now, public negotiations rarely happen. Whatever those 6 opioid settlement legislators decided in their conference, would determine how Mississippi's funds would move forward. On a late afternoon in March, with only a week left in the session, I refreshed the legislative website from my desk in Mississippi Today's office. There's an update to the opioid settlement bill. The 6 lawmakers had finished their negotiations. I read the updated bill, changed into the spare suit I keep at the office, and walked the few blocks to the Mississippi State Capitol. Inside, I went to Creekmore's office and called James Moore.
Hey, Alan.
Hey, how's it going?
It's doing well.
I'm at the Capitol. I am reading the filed report between the conferees of the opioid settlement bill, which I believe has gotten rid of all the local provisions and local reforms.
About what? About local reforms? What are you referring to?
The language Creekmore put in about that local money must be used for public health.
Oh, gee, that was the big one.
It was. There is
It was a big one. The requirement that cities and counties spend their settlement dollars on addiction was removed. In their negotiations, the 6 lawmakers had decided to scrap a measure that would have added at least $40 million to Mississippi's overdose prevention efforts. Nearly all the other amendments, mostly focused at reforming the State Advisory Council, had survived. Basically, the guardrails on the state process had been reinforced. The guardrails on the local money had been quietly thrown out.
Really disappointed that anyone had issues with insisting this money be used for anything they want.
Yeah.
And obviously somebody had issues with it or it wouldn't have been taken out.
By holding the negotiations in private, the lawmakers didn't have to look victims in the eye.
But if that had been a public meeting where it was decided, I can't imagine anybody in the room that's be willing to look at survivors and families and parents and say we still ought to be able to do what we want to with this, even if it's auto.
Yeah.
A few minutes after I hung up with Moore, Creekmore walked up to his office. I caught him before he went in.
Local opioid settlements were removed.
That's correct.
What?
Couldn't get agreement from the conferees.
You
Bottom
signed it.
line.
You signed it.
Yeah. It's either that or the bill goes away.
In the negotiations, Creekmore said some lawmakers brought up a familiar argument, that the local money was meant to reimburse past opioid epidemic expenses, not to help Mississippi's current crisis. In the end, Creekmore said, that perspective moved the room.
They put up a strong argument. It was replacing money they'd already spent.
Do you agree with that argument?
I wanted some guidelines. I did. So I agreed with it somewhat.
Who took it out?
But that's who took it out?
Yeah.
I mean, it's the collective group. I mean, I'm just as responsible as everybody else. I mean, did I want to? No, but at the end of the day, I thought the bill is as good as we can get.
Creekmore had met with Attorney General Fitch's office prior to negotiations. Turns out, the office had met with another one of the 6 lawmakers. I spotted her shortly after my conversation with Creekmore, Senator Nicole Boyd. She echoed the familiar argument when I asked her.
So the monies that went to the cities and the counties were for monies that they had already spent. So it's not abatement, it's a reimbursement almost. Do you know what I'm saying?
Yeah, and I've read the settlement.
Boyd admitted that Fitch's office had shaped her thoughts about local opioid settlements, and she brought that influence into the closed-door conference with her other negotiators.
We have made legislation and given the advice that we have been given by our legal counsel as to what the settlements say, and we have acted within those parameters.
Legal counsel being the Attorney General?
The Attorney General's office, yes. So I believe we have acted within the parameters that have been presented. And
for the next few days, I called and emailed the Attorney General's office. They later sent back a statement, the same one they had sent before, about government spending tons of money on the opioid epidemic, reimbursement, and all that. The more I learned about the negotiations, the more they surprised me. Boyd said this conference had happened over the last 3 days, much longer than most bill negotiations. The local funds were only one agenda item. Most of the time, she said, hadn't been focused on the opioid settlement bill at all. Instead, the lawmakers focused on reassessing dozens of the advisory council's grant recommendations. The lawmakers had only just finished up that night.
Anyway, I'm cross-eyed right now.
No, it's okay.
The House and the Senate members, yes, we went and looked at applications.
All 127?
Not all 127. We really looked at a lot of the top applications, and then some of the applications, looked at the scoring of them and where they were placed and all of that. And so we went back.
The advisory council recommendations were Mississippi's best attempt at using funds responsibly. It was the process the legislature stood up. Boyd's name was on the bill that created it, that tasked the council with reviewing grant applications.
Wasn't the advisory council supposed to do that?
They did do that, but then we also went back and looked at it with another pair of eyes and really thinking about, because they looked for different things sometimes than what we looked for. And then also
In 3 days, behind closed doors, the 6 lawmakers had created a new plan. They did in private what the state had spent the better part of a year building a public process to accomplish, trying to figure out where this money should go, what would save lives. The advisory council could only make suggestions. When it was time to decide the fate of tens of millions of state opioid settlement dollars, the legislature held a private meeting. They retracked the advisory council's recommendations in way less time than the council's rushed process. Who knows what informed lawmakers' priorities? Was it the people who make up Mississippi's recovery community? The people harmed by the companies paying the settlements? The people who showed up to advocate for their lives during Recovery Day? Were they involved?
You know a lot of people who families have been impacted by overdoses. Did you call any of them as you were making this process?
We talked to, yes, and we all are sadly, we all have friends who, but yes, and we talked to different state agency heads that work on these issues and ask just different questions about specific needs and stuff like that. Look, I hope we did.
Yeah.
The 6 negotiators had made their opioid settlement decisions, but the legislative work wasn't done yet. Next, they had to pass the new version of the bill, the one without any mention of the local opioid funds. The Senate passed the bill quickly. On the House floor, Creekmore presented it, at the same podium from which he originally pitched his colleagues on his local government plan.
We removed the guidelines for the locals. The guidelines were in place to kind of guide where the local settlement money could be spent. That has been removed. And
Representative Bob Evans, a Democrat from South Mississippi, raised his hand. He'd had questions about the local spending provisions the first time the bill came to the floor. He had more now.
I had questioned you about whether there were any spending requirements, whether there were any accountability requirements, were there any kind of requirements other than for them to take the money? Are there any such now?
There are no requirements. We're talking about for the locals, correct?
Yeah.
There are no requirements. We got an opinion from the Attorney General, and the Attorney General's office in that opinion said that's what the money is there for, to replace money they'd spent.
We're not requiring them to give any evidence whatsoever that they've actually spent 1 cent in opioid interdiction or otherwise, are we?
No, sir, we're not requiring it.
And no requirements whatsoever of how they spend this, right? I think you already said that.
Correct.
And once they spend it, no requirement whatsoever of telling us how they spend it.
That is correct.
So the mayor and board of aldermen want to give themselves big raises and whatnot. That's fine. They can do that, right?
That is their right to do so.
Would you agree with me that in this bill there is no accountability, no efficiency, or no transparency requirements whatsoever? They don't even have to tell us how they spend it, period, if they don't want to, right?
The locals do not have to tell us. No,
okay.
Sir.
After the discussion, the House members made their final votes.
Has everyone voted?
As everyone voted, close the machine, Madam Clerk. By a vote of 117 yeas, 1 nay, the report is adopted.
Mississippi Governor Tate Reeves would go on to sign it into law. At the same time, lawmakers had to hammer out the state budget, including opioid settlement money. The legislature published what Creekmore, Boyd, and the other negotiators had spent days working on. Their plans for dozens of settlement appropriations, totaling around $60 million. Some state settlement money could be used for anything. From that fund, they apportioned $5 million for ibogaine clinical trials, the controversial effort Creekmore had championed. The majority of the funding came from the pot that had been overseen by the Advisory Council, the much bigger pot. For the first time, the public would see how much lawmakers deviated from council members' recommendations. Turns out, a lot. Organizations that the council graded as A's, B's, C's, and D's would all receive funding. So would one that had been graded an F. Grace House, Healthcare on the Go, and Jeffries Fund didn't make the cut. For nearly every appropriation, the legislature chose different dollar amounts than what the council had recommended. And then there were the organizations the legislature simply decided it would fund. Organizations that had never been reviewed by the Advisory Council. Decisions that were contrary to how lawmakers were supposed to manage the funds. Some grants would go to groups that never applied for money, and others would go to applicants the council forgot to assess. The legislature would grant them Mississippi opioid settlement money, regardless of the established process. When the weekend ended and Monday came, the legislature got to work finalizing these appropriations. The closed-door negotiators stood by their decisions, saying they were justified and necessary. With a few minor tweaks, they passed the grants. And that was it. The lawmakers were done tinkering with Mississippi's opioid settlement funds for the year. It was time for the 2026 regular legislative session to reach sine die, the fancy term for the end.
Gentlemen's motion is that the House stand adjourned sine die. If you favor that motion, indicate by saying aye. Opposed, no. The ayes have it. The House will stand adjourned for the 2026 regular session sine die.
Everyone in the state government wanted to step in and save the day with Mississippi's opioid settlement process. Even Governor Reeves. When the budget bills got to his desk, he vetoed 2 grants set to fund 2 opioid applications the Advisory Council had forgotten to review. Reeves said it would be, quote, imprudent to send settlement money to efforts no one knew much about. But the truth is, no one could save the day in 2026. The state money had been sitting mostly unused in a bank account for over 3 years. And the one proposal to make sure more opioid settlement money would be used to address Mississippi's opioid epidemic, the local money restrictions, didn't become anything other than an idea. Mississippi Attorney General Lynn Fitch played a big hand in the settlements over these 4 years. She finalized arrangements for cities and counties to spend opioid settlement money on whatever local leaders want. And her office hadn't made sure Mississippi's recovery community knew about the settlements and had opportunities to publicly say what they think should happen with them. The thoughts of Attorney General Fitch's office after the break. We're back. Throughout the session, Attorney General Fitch's office didn't talk much with me. They didn't pick up my phone calls, and their emails didn't have much information in them. When the session ended, I expected the same pattern to hold. But Fitch's chief of staff, Michelle Williams, agreed to sit down with me for an interview. What happened? Why did it take so long for Mississippi to start using this opioid settlement money to address addiction?
I regret to say that that's probably a question that's better phrased to the legislature, not to us. General Fitch started going to the legislature back in 2021 with ideas. Actually, in 2020, we started thinking about it.
The office's first pitch, to send most of Mississippi's opioid settlement money to one hospital system, was never enacted by the legislature. Williams said in the years after suggesting that plan, Fitch's office had pushed lawmakers to act. The legislative leaders who served during those years either declined to be interviewed or said they had no memory of those conversations. I asked Williams about the legal advice the office gave Creekmore and Boyd this session about the local opioid money. Williams confirmed the office told lawmakers what they had told me multiple times, that some settlement money should be available to reimburse past government expenses. But she didn't like calling this reimbursement.
What was the reimbursement? When you say reimbursement, I'm not
It's the statement
catching.
that you've sent me, the hundreds of millions of billions of dollars that
The
governments have-
remediation.
Yeah.
So that is sufficient. That I don't think that was what. Well, I mean, and I do stand by that because it is remediation.
Remediation, that is, for the past. The office gave lawmakers another reason for striking the local spending guardrails: the clawback argument. If Mississippi required local governments to restrict their spending, Williams said the office worried lawyers for the drug companies might try to reclaim the money. In 4 years of reporting on opioid settlements, I've never heard anyone other than people from Fitch's office say this was likely, including other lawyers involved in the settlements. In states that required all their settlement funds go toward addressing addiction, haven't faced this legal challenge. But Williams disagreed.
Defense attorneys could always come back and they could say, we don't believe that you are abiding by the settlement agreement. I mean, that's the purpose of a settlement agreement, Alan.
The proposed guardrails on local money would have guaranteed more for addressing addiction, not less. Tens of millions of dollars for public health. But in the end, the Attorney General's office's points had been persuasive enough to help strip local guardrails from the bill. The opioid settlements were supposed to be about the victims, the Mississippians who struggled with addiction for decades, many of whom aren't here anymore. As head of the advisory council, Attorney General Fitch could have centered the voices of these victims. She could have invited them and their family members to speak to the council, share their stories, and offer advice. But that hadn't happened yet, and Williams wouldn't make any future commitments.
I won't speak to the legislature because I don't know, in terms of their public hearing schedule. I mean, you saw what our schedule was like last year. I think part of the reason that they put the people that they put onto that council was because there were people like Mr. Moore. There was such a wide breadth of expertise on that council.
I've spoken with a lot of Mississippians who've experienced addiction themselves, many who've, like Mr. Moore, have lost family members to overdoses. And they've told me that they felt deeply hurt by the way that state leaders and local leaders have managed Mississippi's opioid settlement money up to this point. Could you speak to those feelings of hurt of Mississippians most impacted by this?
I mean, I can. All I can say is that, we feel for all of them. I don't know if you've ever looked at General Fitch's website, and she's gone and spoken and worked with other families that have gone through similar things to what Mr. Moore and those other families have gone through.
After the legislative session, I went back to Sumrall. April was about to turn to May, and Shelby was tending the garden.
So the zinnias that I showed you, Alan, I never knew that they'd be this easy.
You have some saplings.
I threw the seeds down there, that was it, and then it rained, and then there they were.
Wow.
They just start coming up.
When I met the Altmans a year ago, they were frustrated with what they saw of how Mississippi was using opioid settlement funds. Money that could have been used to help people like their daughter, Chelsea Altman Sadler. Now, a year later, their feelings hadn't seemed to change much. Seems like y'all have paid attention to what's happened since then over the last year. What's that experience been like?
I would say frustrating on a level that I don't know what to do, because it's not rocket science. It's a pot of money that's going to some elected officials that they're not going to use it what it should be for.
Political decisions around the opioid settlements colored the anniversary that they were preparing for the following week. A year without Chelsea. Every day, they were still trying to do their best.
I go through sad times, obviously.
Yeah.
And sometimes I know exactly what's causing it. And then other times it's just a depression that sort of comes on me. And I have to remember that I'm supposed to be grieving. It's what I try to do is keep Chelsea with me daily.
Yeah.
She's always in my heart. But I've got a necklace that she made that I'll wear, and she made them with her little hands. It rocks on a leather string that's twisted with all kinds of intricate details. Her memories don't make me sad, they make me happy. If talking in the last year of feelings and how I've dealt with my daughter's death, that's how I've dealt with it. I'm just a mom who's trying to get through it the best I can.
In Hattiesburg, less than a week after the session was set to end, James Moore hosted an event, a tribute to courage and recovery. It's an annual gathering he puts on to honor the area's recovery community and remember loved ones lost. This year, it would be one day after the 11th anniversary of his son Jeffrey Moore's death. He had sent invitations to each of the 6 lawmakers who had negotiated the provisions on the local spending. None of them came. But hundreds of others did. Local musicians played, and speakers talked about their recovery.
For anyone that is living clean, sober, or abstinent one day at a time is a living miracle.
At the front of the auditorium, candles were laid to honor those who hadn't survived. Moore's daughter and Jeffrey's sister, Jenny, played the piano as attendees lit candles for their loved ones. Moore told a story from when his son was 6 years old, about a small Schwinn bicycle, rusted and secondhand. Jeffrey didn't want the bike at first, but then he and his father repainted the frame, replaced the wheels, and added a little glitter. Jeffrey learned to love it.
I wanted my son to know that sometimes we have to look beyond the surface to see the value in something, and to see that value, we have to invest ourselves into finding that value.
The event lasted just over an hour. At the end, the lights came back on, and Moore and his family blew out all the candles. This year, Moore viewed the anniversary of Jeffrey's death through a different lens. He said he likes some of the new updates to Mississippi's opioid settlement laws, the stronger conflict of interest rules, the mandate to work with an outside group to improve the advisory council process. Even if the lawmakers' grant choices worked out, he worried about how the legislature made its decisions, stripping the local money guardrails, deviating from lots of advisory council recommendations.
I don't think it is a wise move for them to be making the decisions that they charged us to make, or even overturning or modifying the decisions that they charged us to make, unless they're willing to sit down and go through all of those grants page by page and do the background research themselves to make a better decision. Every single one of us that was appointed to that for a reason based on our experience, all of us came to that with something to offer. And for some of the changes that were made, it just didn't seem like our effort was time well spent.
The lawmakers are the people who get to make the final calls with state funds. The power of the purse. They're quick to say that in Mississippi, public money goes through the legislature. Moore sees it another way.
I question the phrase public money. This money came from private pain. It did not come from tax resources. It didn't come from government grants. It came from individual losses from the families and from the individuals who paid the price of the greed from the companies that are paying into the settlement fund.
I asked Moore his thoughts on Mississippi's opioid settlements in general. Was he still hopeful about the state meaningfully addressing the opioid epidemic? To my surprise, he was.
The last few weeks, some decisions were made that were questionable, but look at the outrage that came from the constituents. The response from the general public would not have been nearly that way just 5 years ago. The general public is outraged over some of the opportunities that were presented and then were walked away from in the last couple of weeks.
I imagine no one wants this addiction crisis to continue. Not Attorney General Fitch, Not city and county leaders, not the advisory council, not the legislature. Certainly not the families like the Moores who've lost loved ones, or the Mississippians who've struggled with addiction for years. But wanting change and making that change real are very different things. Caring is easy. In my reporting, nearly everyone told me they care. But Mississippi opioid settlement money is something tangible. Officials had the means and opportunity to put this all into practice. A chance to put the money where their mouth is. Not just for, but also with, the people most harmed. For the most part, that hasn't happened so far. And within this ongoing crisis, that may mean more people will needlessly suffer.
Yes, we are going to apply again, even though we possibly know, what may happen again, because we have hope.
I think we could have done a better job, and going forward, we will do a much better job.
This funding needs to get out there now. We've been waiting.
There's still an opportunity for us to do right by the majority of the funds.
I don't think there's enough conversations happening.
It may not always be this way. Mississippi will get opioid lawsuit funds for over a decade to come. But whether or not things change remains, at least for now, unsettled. Black Box is a production of Deep South Today, Mississippi Today, and Goat Rodeo. The show was written and reported by me, Alan Siegler. Editorial supervision by Laura Santhanam. The show's lead producers are Max Johnston and Jay Venables. Executive producers at Goat Rodeo are Megan Nadolski and Ian Enright. Executive producers for this season are Adam Ganeshow and Emily Wagster Pettis. Michael Guidry is Mississippi Today's editorial director of multimedia. Kate Royals is Mississippi Today's managing editor, and Mary Margaret White is the newsroom's senior director of development and partnerships. Additional production and editorial assistance at Goat Rodeo from Kara Schillen, Isabel Kirby McGowan, Rebecca Seidel, and Hazel Hoffman. Additional production and assistance at Deep South Today from Dennis Dean and Bethany Atkinson. Fact-checking done by Andrea Lopez Cruzado. Our title theme and original score comes from Lucy Wren Cooper and Tyler Tadlock of Sadbath. Music supervision and additional scoring by Max Johnston, Jay Venables, and Ian Enright. Our marketing and audience outreach efforts are thanks to Madeline Chosich, Cherry Agarwal, Alyssa Bass, and Johanna Derlega. Special thanks to Aneri Patani and Howard Burkus. Mississippi Today is part of the Mental Health Parity Collaborative, a group of newsrooms that are covering stories on mental health care access and inequities in the U.S. The partners on the collaborative include the Carter Center and newsrooms in select states across the country.